Hey, Dr. Lindsey and Wendy here. This is just a real short update on a guy we did about 4 years ago, and he just rolled in last week. So we do, 30 Indians, 10 Pakistanis, and 5 Afghans every year. And whether you like it or not, they all have the same heads. And so there's 2 varieties. All these guys have heard this spiel. Guys with skinny, weak hair, and guys with these boxwoods that are big and bushy that cover everything. And so this is a fine-haired Indian guy, and you can see from his before picture, he's got nothing up the middle. And so we didn't have to really trim anything down. We packed him as tight as we can get. That's pretty well packed in there, Wendy, didn't you? It's fine hair, but you packed it pretty good.
Yeah, there's nothing else that will fit in there.
And then here he is at a week out. He did a decent job cleaning. Let's see, what picture is that? This is a month. And then at a month, he shed pretty much everything that we put in. And I said, well, come back in 6 months and let's see how you're doing. And I think he left the country and he rolled back in last week with his sister.
years?
4 years.
4 years now?
Yeah, 4 years out. And so here he is, the way he styles his hair. And then when we comb the hair back, it's just like that fine-haired video we did. You always need a few more hairs at the hairline. And so I talked to him about doing another case further back at some point. And I'd take a few hundred grafts and put along that left part line. But if this is confusing to you, look at our recent video, a collection of fine-haired cases where you can pack hair as tight as you can get it, but with skinny hair, it's still never thick enough. And so, but this looks good. And then a couple videos or a couple pictures of us combing it. And then if you look at the back of his head, that scar's almost impossible to find. So
you can't see it. He wears his hair long and covers it to the side.
Yes.
Sometimes there's patients that will have a hair transplant and they don't style it well. I think they need to work more at styling and making it look so it looks
right
thicker. Because if you layer it a little bit, it looks good. But then if you have a long hair and just
right
crop it over, it looks like a comb over. But
he was doing a comb over for years. Now he doesn't have to do a comb over, but he hasn't updated his hairstyle.
Yeah,
I think that's what the deal
but that's what. Yeah, and I told him. I said you need to change your hair a little bit. That will make it to you're not bald to cover. I mean, you're not bald anymore. You can cover and style it.
And we've had a couple of kids or a couple of guys that have been like that we've sent out to.
I take them to the salon so they can get a stylist. Yeah,
because we've done a few hairstylists hair transplants.
Yes. And they help us. They help us how to teach them how to style it, what to do to make it look fuller.
That's not part of the package deal here.
It's not, but we get close to our patients.
Sometimes we'll do that.
Yeah.
And the most frustrating thing is though when we do that, they look good. They come in for pictures, and then we see them a week later, and they got a hat on, and their hair's all scray.
Ah, yes.
So, this is a typical 4-year out fine-haired Indian. It looks great, like many 4-year out cases, whether you're white, Indian, Asian, or black. It may be reasonable to consider seeing a real stylist once in a while. I know this jacket, I got my first year of marriage, and I'm still wearing it. That's 23 years ago. So I'm not immune from that same criticism. But if Wendy and I can help you, give us a call.